Hello, I'm Kate Diaz and I am a student nurse at Brokenshire College of Davao. Today, I will be giving you insights about one of the common diseases known here in the Philippines, which is HIV or Human Immunodeficiency Virus. I will be talking about what really is HIV, what are the risk factors this disease might bring to our health, the symptoms we all should know when we are infected of the HIV disease, and lastly, what are the kinds of treatments being done in order to get better with HIV or what we call human immunodeficiency virus. To begin with, let's talk about what really is HIV. Where did this disease originated? So, HIV or human immunodeficiency virus is a virus that attacks the body's immune system. Our immune system defends our body against infection. Now, if our immune system gets attacked by the HIV, then our capacity for disease prevention and control is reduces. When that happens, it will be greater likelihood of infections and other health issues occurring in the human body. HIV infection in human originated from a Central African chimpanzee species until it reaches the humans. HIV is found to be a virus that could kill you. The majority of people who contract HIV do so through oral or vaginal sex or by sharing needles, syringes, or other equipment for a drug injection. Let us now have the causes and symptoms that one may experience when having human immunodeficiency virus. The symptom of HIV depends on the phase of infection. It has 4 types of infection, namely primary infection, which is acute HIV, clinical latent infection, which is chronic HIV, symptomatic HIV infection, and lastly, progression to AIDS. It is called as primary infection when some people infected by HIV develop a flu-like illness within 2 to 4 weeks after the virus enters the body. The possible signs and symptoms of this includes fever, headache, muscle aches and joint pain, rash, sore throat and painful mouth sores, diarrhea, weight loss, cough, and night sweats. In this stage of primary infection, the infection spreads more easily. Next, we have clinical latent infection. This is the stage of infection where many people may not have any symptoms or infections during this time. In the stage of symptomatic HIV infection, you may develop mild infections or chronic signs and symptoms such as fever, fatigue, diarrhea, weight loss, and pneumonia. The last stage would be progression to AIDS. This stage is where you'll be more likely to develop diseases that wouldn't usually cause illness in a person with a healthy immune system. These infections may include sweats, chills, recurring fever, chronic diarrhea, persistent white spots or unusual lesions on your tongue or in your mouth, unexplained fatigue, weakness, weight loss, skin rashes, or bumps. Now, I would like to introduce to you what are the treatments for this disease. HIV disease is known to have no cure, but there are ways to control it, such as not having sex, never sharing needles, and using condoms the right way every time you have sex. Also, the medical way to control it by using pills or shots. We have PrEP or post-exposure prophylaxis, which means taking medicine to prevent HIV after a possible exposure. The benefits we can get by having HIV treatments is that you can improve your life and living by living longer and happier. The treatment of HIV can last for about 7 to 12 months to remain undetectable for an extended period of time to HIV disease. It is necessary to take pill each day. As a student nurse, I have with me the important tips that I would like to share with you to manage HIV. First, practice safe sex. In addition to preventing the spread of HIV, condoms also protect you and your partner from other infections and sexually transmitted diseases. Second, get tested for other STDs because many STDs don't cause symptoms. You need to get tested. If you don't, You might not even know you have one. Third, prevent infections and illnesses. HIV reduces the effectiveness of your immune system, making you more susceptible to all viruses, bacteria, and germs. Fourth, follow doctor's orders about your prescriptions. To avoid having to miss a dose while you are away from home, make sure to take your prescriptions at the same time each day and keep your medication with you at all times. Fifth, don't abuse drugs or alcohol. Overuse of alcohol and drugs can exacerbate depression. Sixth, quit smoking. Quitting smoking is good for everyone. Seventh, manage physical and emotional health problems. HIV-positive individuals frequently experience depression, and HIV-related stress can exacerbate depression symptoms. 8. Exercise mind and body. Physical and mental exercise can help you maintain a strong mind and body.
This is the end of my video, and I do hope this helps you better understand what HIV is, or human immunodeficiency virus, and how you'd be able to manage it if you acquire this disease. Thank you for watching, and have a great day.